Now, Caitlin asks, I've heard that patients with a history of cancer need to first obtain clearance from their medical doctor before undergoing spinal manipulation. Why is that the case? Would adjustments stimulate the cancer cell, causing it to grow or metastasize? Well, no, a chiropractic adjustment will not stimulate cancer or cause it to grow or metastasize. The reason that you always, if you're a chiropractor, in fact, I had that experience fairly recently, when you're a chiropractor and you have a patient who has a history of cancer and they have back pain, you always have to assume the possibility that that pain is not coming from a biomechanical cause. It's not coming from the things that chiropractors work on, which are joints that aren't functioning properly, but an actual metastasis to the bone, or possibly, less likely, a primary bone cancer. So there are signs of that, there are symptoms of that we learn in chiropractic school. I've also taken postgraduate courses in things that can mimic biomechanical problems but are serious medical problems. So we don't want anybody in our office who has a serious medical problem unless they're being co-managed by a medical doctor, because you don't want a patient with cancer to come to you and be worked on and adjusted for possibly weeks or months, and you missed the fact that they have a cancer growing, and the whole time you're working on them, you're delaying the kind of treatment that they really should have to allay the cancer, to treat the cancer. So that's mainly the problem. I mean, that is basically the problem. There's also a chance that if they have metastasized cancer, that the bone will be brittle. And it's unlikely, but it's possible that you can cause a fracture by doing an adjustment to a bone that has a lot of metastasis that has actually weakened the bone. When a person is at that point, unfortunately, they're quite far along in the disease, and it's very difficult for even oncologists to help them at that point. But you have to be careful as a chiropractor. You don't want to hurt anybody, and you certainly don't want to misdiagnose people or delay proper treatment.